Hello everyone, I am Dr. Muralidhar Varma, Professor in Department of Infectious Disease, Kasturba Hospital Manipal. I am here to talk about a very burning issue, the global problem of antimicrobial resistance. Before we understand what is antimicrobial resistance, I think it is important for us to know what are antimicrobials and what are antibiotics. Antimicrobials are the drugs which doctors use to kill bacteria, virus, fungus. When we use the word antibiotics, it means that the drug which is used to kill only for bacteria. So now what is antimicrobial resistance? Whenever bacteria, fungus or virus do not die to these antimicrobials, we call it as antimicrobial resistance. So this is not only happening in human beings, this problem occurs even in animal industry and agricultural industry. Now, why is this antimicrobial resistance important? Antimicrobial resistance causes severe mortality, morbidity, and also it spreads the infection to person if it is not taken care of. It also increases the cost of the patient in the hospitals. It can cause serious complications even after the patient recovers. It is estimated by WHO as well as the World Bank that the GDP of the whole world can come down to 3 to 4% in the next 10 to 20 years if this antimicrobial resistance is not addressed to. And millions of people can be pushed to poverty if this AMR is not tackled. Now, why is there is AMR? There are multiple reasons for it. First, we need to understand that every living being in the world does its best to survive, just like human beings do. When antibiotics are given to the various microbes, they try to survive by themselves. This is called as natural selection. So this is happening since millions of years. However, because of human activities, this whole process is getting accelerated now. So the antimicrobial resistance rates have significantly increased in the last 100 years or so, since the time antibiotics have been discovered. Do you know that in animals, the amount of antibiotics used is 9 times higher than the antibiotics used in human beings? Apart from that, there is also lack of awareness about this problem. Plus, governments worldwide have not invested enough amount of funds to address this issue. As a result, the surveillance data is not available, so many people are not aware about it. Then the other reasons could be sanitation. Most developing countries, sanitation is very poor, the water qualities are not great. As a result, bacteria develop resistance in the water sources. Plus, the drainage systems in most third world countries are very poor. As a result, the drinking water gets contaminated, which contributes to the antimicrobial resistance. Plus, there is no legislation to control the antibiotics, and there is no social and government will to address this problem. Now, what can we do to address this problem? Many ways we can address this problem. First thing, I think from the government point of view, they should create systems in place and increase the funding so that there is adequate surveillance and adequate measures to control this AMR as well as dissipate this information to all the stakeholders, like educational programs, not only for the healthcare industry, but to the community, to school level, colleges, trying to encourage them to address this problem at various levels. Second thing is, legislation has to be brought where antibiotics are not misused. Especially, a lot of people take antibiotics over the counter. They just go to a shop and then purchase antibiotics without even indication. So legislations can address this problem. Third one is educating not only the healthcare sector like doctors through CMEs, regular webinars or YouTube videos like this, but the focus should also be for all the younger generation who are predominantly into the mobile phones, etc. So if the government puts an effort to dissipate this information, address the ill effects of this global threat of antimicrobial resistance, it will definitely help. At the hospital level, I think every hospital should have a strong infection control department along with antimicrobial stewardship programs. These two programs will help in reducing the AMR rates in the hospital level. The third one is sanitation, which is the government responsibility. The water supply to various households, health industries and healthcare sectors should be optimal and should be adequate. And there should be a system in place where the drainage pipelines the drainage system does not mix with the potable drinking water. Then finally, about the action plan, every government should have what should be their targets in the next 5 years or 10 years. How can we reduce it? As I've already told you, the antimicrobial resistance are very high. And remember that this antimicrobial resistance is not only for the bacteria. We are seeing a lot of patients now with tuberculosis who are drug resistant. Malaria patient not responding to the usual malaria drugs. Simple infections like urinary tract infections also not responding to oral drugs. We end up giving IV drugs. So this sort of messaging is very important by the healthcare industry people, government, and also to the community. So to conclude, it is important that everybody should be aware of this global problem and everybody should do their bit to reduce it. From the general public, please do not take antibiotics over the counter. Please take it only when doctor prescribes, and duration as doctor prescribed, and frequency of tablets as doctor prescribed. From healthcare sector point of view, it is important that everybody maintains a good stewardship programs and anti-infection control programs in every healthcare sector. I think that is very important part of this global challenge of antimicrobial resistance. Thank you very much.